So we're at the American Academy of Ophthalmology in Orlando, and I have the pleasure and honor of interviewing Dr. Richard Abbott, who's the president of the American Academy of Ophthalmology. Dr. Abbott is also a professor of ophthalmology at the University of California, San Francisco. My name is Sophie Bakri, and I'm a retina specialist at the Mayo Clinic. Dr. Abbott, thank you very much for agreeing to meet with us today.
You're welcome. Pleasure to be here.
So, Dr. Abbott, you've traveled extensively over this past year as the Academy President, both domestically and internationally. What are some of the most important lessons you've observed and learned on your travels?
Well, I think, again, traveling both domestically and internationally, they're a little bit different. Different needs, different items that come to the forefront. In the domestic issue, there tends to be concern among ophthalmologists, obviously about appropriate reimbursement for what we do as eye surgeons and physicians taking care of eye problems, and also making sure that appropriate quality of care is given to our patients. And some of this falls into making sure that people are well trained who are doing ophthalmic procedures, and making sure that the training is appropriate and sufficient for that. Regarding the international scene, it depends also what part of the world we're visiting. I spend a lot of time in Asia, and particularly in China, and in that part of the world they're very interested now in evidence-based medicine and moving their care into making sure that they're meeting the standards that are set up both nationally and internationally, and the Ministry of Health is very interested in that. In parts of the more developed world, I think we're seeing a lot of interest in internet education, in new technology, new procedures, kind of like we see here in the United States. There's a lot of interest in new treatments for cataract, diabetes, macular degeneration, glaucoma, and I think that excitement is global.
So you've been involved with the American Academy of Ophthalmology's initiatives to improve the quality of care for over 25 years now.
Yes.
Where have we been, and where are we going with this?
Well, we really got into the official quality of care arena, if you will, in response to an American Medical Association initiative or statement that said it was our duty as physicians to provide quality of care. This was just basically an ethical position. And it made sense to everybody. Of course, we want to provide good quality for our patients. But this revolved really around doing the right thing at the right time, being well trained to do it, and knowing what to do. And so we formed a quality of care committee in the mid to late 1980s, and from that we defined what we call the core elements of quality, and that had to do with basically practice guidelines at the time, or we called them preferred practice patterns. So these were developed, first one in glaucoma, then in cataract, and over the years now we have 18 guidelines, and they're regularly updated. These provide evidence-based information for practitioners to use in their practices. Maintenance of certification, the performance measurements, the performance quality reporting system that we have to use for payment and Medicare for some of the things we do. These are all based on quality measures that the Academy has developed over the years. So I think now we're continually upgrading our guidelines, continually looking at how to make them relevant to what we do as practice, how we link them to outcomes. And where the quality of care movement in the Academy will be going is to move from what we call process of care, what we do, it's a clinical guideline, to measuring what we do and the effect it has on a patient, and that is the outcome. And I think that's where the effort is now evolving.
So is the Ophthalmology model for quality care still relevant?
Yes, I think it is. And that model was described and published back 25 years ago, where Dr. Donabedian talked about three elements in the definition of quality of care. And one is structure, where we practice, the setting we practice. The second is process of care. What do we do to the patient, whether it's a test, an examination, a surgical procedure. And the third is what happens to the patient, the outcome. And I think we've looked at structure, the type of clinics, the infrastructure in the hospital and the ambulatory surgery setting. This is all structure and part of quality. The second part, the process, is our preferred practice patterns, our clinical guidelines, and we make them evidence-based. And the third part is the quality outcome, look at making sure we have the best outcome and measuring that and having the data then to justify what we do and the payment we receive for it.
So, Dr. Abbott, what are your plans and goals when you step down as the Academy President next year?
Well, after this meeting, I'm going to rest a little bit. It's been a very busy, hectic meeting. I've enjoyed it a lot. My term ends the end of December, and I will still remain on the Academy board, but my interests have always been in quality of care, and I'll remain involved in the development of the registries and the continued improvement and work on the guidelines. I'm also very interested in taking the process of clinical guidelines and what we do with them to other countries, and now I'm working not only in China but also in some countries in the Middle East and also in Latin America in furthering the use of these guidelines and making them very practical, ultimately to improve the quality of care globally. So I have still a full plate, and I look forward to moving my energies in that direction.
Well, thank you very much for honouring us with your presence here today. We appreciate your time, and on behalf of Mayo Clinic, I'd like to thank you again.
Thank you. My pleasure.